I'm Erin Walker, owner of Body Love Wellness, a holistic wellness community for women. And March is National Endometriosis Month. And so today we're going to talk about the 411 on what endometriosis is and how you can get an accurate diagnosis. And stick with me this week because I'll share more about ways that you can support endometriosis naturally. So, in its simplest terms, endometriosis is a condition that affects about 2 to 10% of women. It can be quite painful. And in short, it is when tissues that normally line the uterus grow outside of the uterus. You may or may not be aware, but as we have hormonal fluctuations throughout the month, the lining of the uterus thickens in order to prepare for a potential fertilized embryo to implant. And then when that fertilization doesn't occur, we shed that lining of the uterus every month, therefore having a period or a menstrual cycle. And this ebb and flow of hormones and thickening and shedding of the lining of the uterus happens on a monthly basis. Now, in the case of endometriosis, that endometrial tissue grows outside of the uterus. And it still responds, though, to that monthly fluctuation of hormones. And so as hormones increase, it thickens. And then when the body tells you that there was no pregnancy, and so you need to then shed that lining, the bleeding still happens. It's just this now is happening outside the uterus, so those cells cannot leave the body. So you have this growth of this tissue that should be happening in the uterus and escaping the body now happening in other places, like the abdominal cavity, the rectum, and other places, which then over time causes problems because the tissue continues to grow and the bleeding happens, but it does not have a way to escape. Now, interestingly, there isn't a documented cause of endometriosis, but there are a lot of hypotheses. One of them is that sometimes when women have their monthly periods and bleed, it backs up a little bit into the fallopian tubes, and there's a gap between the fallopian tubes and the ovaries, and then that then allows that to seep into the abdominal cavity, for example. But there are also other hypotheses. But some signs and symptoms are lower back pain, abdominal pain around the time of your period, excessive bleeding, pain during intercourse, pain with urination or bowel movements, infertility, GI issues like diarrhea, constipation, bloating, and even extreme fatigue. And so you can see how this can go undiagnosed or misdiagnosed because many of these symptoms can be other things. And so really the best ways to diagnose endometriosis is obviously doing some lab work, ultrasounds, MRIs, CT scans, a thorough medical history. But in order to have a confirmed diagnosis, you really need a laparoscopy and a biopsy of the tissue so that they can see if this is uterine tissue that shouldn't be there or another tissue that is supposed to be in that part of the body. Now, a few possible causes. Hormone imbalance is one of them. This is, from a functional perspective, considered to be an estrogen-driven issue. Estrogen dominance promotes growth of tissues, especially in the female lady parts. And so when you have more estrogen than progesterone or not enough progesterone to fight against the estrogen, it can promote scenarios like this is one thought. Immune dysregulation in the body, an imbalance in your gut microbiome, a genetic predisposition, or other environmental factors like exposure to toxins and chemicals that are not effectively leaving the body. From a functional root cause perspective, these are some of the hypotheses of things that can promote endometriosis in the body. So stick with me this week to learn more about testing for endometriosis and some natural supports to help your body to calm this inflammatory and growth response. Have a great week.